Hi, this is Nada. In this video, we'll talk about autonomic nervous system. I'm pretty sure after watching this video, the concept of both sympathetic and parasympathetic nervous system, why it works, when it works, will be quite clear to you. So don't forget to give big thumbs up, like, comment, and subscribe my channel. If you haven't watched my previous video of nervous system classification, so kindly watch it first. So it will be easy for you to understand nervous system subdivision. I have given the link below. Sympathetic nervous system helps the body in fight and flight condition or prepare your body when you are in this situation or danger. Okay, so if you imagine if you are in that situation, your heart rate increases because there is need to increase blood supply to skeletal muscles. That will help you in fighting, so that increases heart rate, that is tachycardia. It will increase blood pressure as well, so will experience hypertension. Because your heart rate increases, so need more oxygen to fulfill body demand. So rate of breathing also increases and bronchioles dilate to supply more oxygen to lungs. That is tachypnea. In that situation, you must need to see more. Even if it's dim light, so your pupil in your eye dilates, that is mydriasis, so that more light can enter in your eyes, help you to see in danger. As the blood flow towards skeletal muscle increases, at the same time, blood flow to your gastrointestinal tract, GI tract decreases. That may decrease peristalsis and causes constipation. And the person also experiences dry mouth. When a person is in fight and flight condition, urination stops, or I can say like person can hold urine for longer period of time, that is urinary retention. And it makes sense. Obviously, in that situation, who would think to urinate? So these are common physiological changes which body experiences when sympathetic nervous system activates. When you are nervous or stuck in such situation, so it helps you to survive in that circumstances. Parasympathetic nervous system is exactly opposite to what I discussed in sympathetic nervous system. Parasympathetic nervous system counterbalance sympathetic nervous system. It helps when body is in resting state. So your heart rate is low and normal, blood pressure is low, that is bradycardia and hypertension. Your rate of breathing also decreases, that is bradypnea, and bronchoconstriction takes place. Blood flow towards skeletal muscle is low because muscles don't need much energy when your body is resting, while blood flow towards digestive tract increases. That increased peristalsis also helps in the process of digestion and person experiences diarrhea. There is also excessive salivation. When a person is in resting state, there is no need of enough light. There is no need of pupil dilation. So pupil constricts, that is meiosis. The individual can also urinate, so the process of urination takes place. Here is a mnemonic for you. To keep remember the changes takes place in parasympathetic nervous system. It will help you to keep remember the signs. The mnemonic is dum, she. And these are all same as I just discussed. The responses of sympathetic nervous system are controlled by thoracic and lumbar nerves, also called adrenergic nerves. But in parasympathetic, responses are controlled by cranial and sacral nerves, also called cholinergic nerves. In sympathetic nervous system, as ganglion is near to the spinal cord, so preganglionic fibers which are before the ganglion are short and postganglionic fibers are long. While in parasympathetic nervous system, as you can see that the ganglion is close to the effector organ, far from the spinal cord. This is the reason the preganglionic fibers are long and postganglionic fibers are short. Neurotransmitters, which are chemical messengers released from the nerve terminals of the neurons, play a vital role in bringing all of these responses. In sympathetic nervous system, neurotransmitters involved are epinephrine, norepinephrine, dopamine. But the major neurotransmitter is norepinephrine, which is around 80% released in sympathetic nervous system. Adrenergic receptors involved in sympathetic nervous system are alpha 1, alpha 2, beta 1, beta 2, beta 3, and dopaminergic receptors. How these receptors actually help the body maintaining body physiology, for that you have to watch my next video. Cholinergic receptors are muscarinic receptor, and it's acetylcholine, which is the only neurotransmitter involved in parasympathetic nervous system. This picture briefly explains and makes it more clear the neurotransmitter and receptors involved in transmission of signals. The two color neurons that you can see are preganglionic and postganglionic neurons. In sympathetic nervous system, the preganglionic fibers release acetylcholine and there are nicotinic receptors, while the postganglionic fibers, sympathetic nervous system, release norepinephrine and there are adrenergic receptors, which can be either alpha 1, alpha 2, beta 1, beta 2, and beta 3. That will be more clear to you in my next video of receptors, as I already told you that the major neurotransmitter in sympathetic nervous system is norepinephrine. The only exception is in sweating, which happens when body is in fight and flight situation, means sympathetic nervous system. But the neurotransmitter is acetylcholine at postganglionic nerve fiber and are muscarinic receptors involved. For adrenal medulla, which is only under sympathetic innervation, means there is no control of parasympathetic nervous system over adrenal medulla. So when adrenal medulla receives signals from sympathetic nervous system, it releases mainly epinephrine into the bloodstream, which causes blood pressure to rise, hypertension, increase the heart rate, tachycardia, bronchodilation, same signs of sympathetic nervous system as discussed earlier. In parasympathetic nervous system, preganglionic nerve fiber releases acetylcholine, same as sympathetic nervous system preganglionic fibers, and there are nicotinic receptors involved. But the postganglionic nerve fiber also releases acetylcholine, but the receptors involved are muscarinic receptors. So if I conclude this whole story, it means all preganglionic nerve fibers, whether in sympathetic or parasympathetic nervous system, release acetylcholine and there are nicotinic receptors involved. But in sympathetic nervous system, postganglionic nerve fiber release norepinephrine on effector organ and there are adrenergic receptors. But in parasympathetic nervous system, postganglionic nerve fiber release acetylcholine on effector organ and there are muscarinic receptors involved. I hope you guys liked and I really hope it makes sense to you. If it did help you, kindly like, comment and subscribe. Share the video if you can. See you guys until the next video.